So anyway, very good morning and see, like in last class we spoke of a very important group, and if you recall, the group that we spoke was acid group. A part of acid group is what we had discussed, and a quick recall of what we had done in the last class. We'll have a quick recall, and before we have a quick recall, see what also I try to make you understand in the last class is how a group characters are to be studied. What are the probable endings under which a group character has to be studied for a third year student is what we discussed. Okay. So I have some, this is on the last slide so that we have a small continuity, like where exactly we had stopped. Okay. See now here, we'll try to quickly recall the topic covered in form of some small questions so that both of us understand, okay, how much you have understood acids. Okay. So the first very important thing is, what is the action of acids on mucous membrane? Very good. It causes two very important things, inflammation and ulceration. See, this also gives us a clarity that inflammation, I told you, is more of which mechanism? Solar. And ulceration is more of symptomatic. So sphere of action gives us a clarity about the miasmatic background of a remedy. Okay? So very good. The second very important thing is, recall the acids which are thermally hot. Very good. Two acids should come to your mind. Fluoric acid and nitric acid. These are the only two acids which are thermally hot. Rest of the acids are chilly. And third very important thing is, I give you many elements. And the question for you today is, just pick up 4 elements from what was told in the last class. Side effects of anesthesia, very good. Surgical shock, good. Side effects of drugs and narcotics, beautiful, good. Loss of vital fluids, mental exertion, physical exertion, dependency, etc. Very good, keep it up. Physical appearance of acids. How do they look? Lean, thin. They look old, they look debilitated. See, this, I had a case last night. We had a gentleman aged around 40 plus, early 40s, 42, 43, and he's been suffering with bad dermatitis, exfoliative dermatitis. And we were shocked. He had come with a jerkin on, he had a thermal inside, he had a shirt, and he had a jerkin. We did not realize. But then suddenly, I felt is very, very lean thin. And I have a small video, but no permission to share right now. But what I want to make you understand is, his body weight was 33 kgs. Can you imagine? 33 kgs was his body weight. And he's been having chronic diarrhea. Almost till 11:30 we were with this case last night, trying to understand why this gentleman, aged 42, 43 years, had to suffer so much. And what is the miasm here? Miasm, don't think of solar, don't think of psychosis. The miasm is pure. Don't even use the word syphilis. The miasm is pure syphilitic. My only question, the lady assistant also was sitting with me till 11:30 last night, and we were trying to understand that why this gentleman had to go into this particular state at a very young age. He's been suffering for almost 5 years, bad dermatitis. We call it as exfoliative dermatitis. Out of interest, you can go back and study. So, now this is the physical appearance of that particular man we saw last night. I didn't prescribe him an acid, but I want you to understand, they come to our clinic, and whatever is written, whatever is told in our literature, you will find it in front of you in your clinics tomorrow. And that is what I insist, that what you study theoretically, they have to be experience practically in your clinic, and you need to apply what you study. Okay? So acids, they are very lean, thin, debilitated, old looking. Now this gentleman I was talking to you about, what remedies come to your mind? He was 42, 43, badly, I don't use the word, badly emaciated, hardly any flesh, bones, thin bones. You can count the ribs on his chest, the surface anatomy that is taught to you in first year. I mean, it's all the bones are visible. What remedies come to your mind? Huh? What remedies? What remedies? I know you are in third year, but start thinking. Very good. Acids is good, agreed. But I did not prescribe him acid because his pathology did not match with an acid. That is also very important. Just because somebody is lean thin, you can't prescribe an acid. You getting my point? You cannot prescribe an acid. That's important. Okay. So we'll get back. Physical appearance, you are absolutely right. And we also spoke of mind. The generals, what could be the probable mental symptoms of acid is also what we discussed. What were the probable mentals? They are very good. They are happy, cheerful, extroverted, good. Yes. Mental exhaustion, very good, beautiful. Fatigue, mental fatigue, memory issues, and in the last day you see a lot of hatred, mental frustration coming up, and revenge coming up, not caring, indifference setting in. That was the mind of acids. Okay. So now what is left? When I did acids, I told you I will be explaining the acid group under introduction. And second heading was mental generals. And third heading that is pending is physical generals. So next 30-40 minutes we will be looking at the physical generals of acids. Tomorrow you might have a question in your exams. List the generalities of acids. So please remember three headings. Introduction, which has a lot of things, is there in the previous class, and then we have mental generals, and then we have physical generals. Okay. Now what are the common headings under which we discuss physical generals? What are the common headings? Physical generals. What? Very good. Desires, aversions. Ailments, we have done it under introduction. What is it? Very good. Thermos, that also is done under introduction. Habits. Modalities, very good. Agreed. Ailments is done in introduction. Physical generals. Okay, sleep, thirst, desires, aversions. Okay, character of pain. Okay, which side the acid affects? The side affinity. So we will be starting with the side affinity, and we have only two sides, as you know, right and left. And many homeopathic remedies have an affinity for right side and they have an affinity for left hand side. Can I quickly have some right side remedies? Very good, lycopodium. Apis mellifera, beautiful, good, keep it up. Belladonna, yes, that. Okay, Bryonia. Last 20 plus years I am teaching. Whenever somebody talks of Bryonia, one student will definitely talk about immediately the stocks. See how closely they both are related. Okay, anyway. Right sided remedies, similarly left sided remedies. Lacasis, Puja, good. Berberis. Okay, and many more remedies. There are a list of remedies. Now what I want you to understand here is majority of the acids are right sided. For your information, majority of the acids are right sided. I have just given you the list of right sided acids like sulfuric acid, phosphoric acid, acetic acid, benzoic, carbonic acid, fluoric, oxalic, picric. All major acids are right sided. There are very few like benzoic, nitric, muriatic, formic and phosphoric. Which are better? Left-sided. So you see a big list mentioned under right side. Very few they act on the left-hand side. See, it's a different thing and this is a different thing. Okay. Benzoic. Or I mentioned under both. Okay. I'll just recheck and I'll let you know. See, and another very important information is majority of the acids are deep acting remedies. Majority of the acids are deep acting remedies. Okay. So when I say deep acting, the action lasts for a longer period and the organ affinity or the pathology that it causes are again very deep. Deep pathologies. Deep pathologies. I'll tell you what those deep pathologies are after some time. Okay? So we are talking of physical generals and we spoke of the side affinity and then we also realized that majority of the acids are deep acting acids. Very important. Very important. Acids, majority of the acids, you know, the miasmatic background is syphilitic. So the disease the acids produce, you see all deep-seated diseases. That's what I was trying to tell you when I said it's a deep acting remedy. It causes deeper pathologies. So majority of the acids, when you read from acetic acid till the last acid, whatever it is, phosphoric or sulfuric acid, they all have a tendency to produce ulcers. They all have tendency to produce ulcers. Okay? So, ulcers is what you see in majority of the acids. Okay? For example, sulfuric acid. Beautiful remedy for aphthous ulcers. Sulfuric acid, beautiful remedy for aphthous ulcers. And then you also, this is what I was trying to tell you about aphthous ulcers. Then you also have nitric acid, carbolic acid. I mean, one of our PG scholar, I was requesting him, he has a beautiful case of an ulcer treated with carbolic acid. When 10 governments are asked him to present that case, beautifully cured with carbolic acid. Okay, so ulcers, deep ulcers, ulcers which bleed easily, varicose ulcers, non-healing ulcers, aphthous ulcers, you can think of acids. And the major acids which are indicated for ulcers are sulfuric acid, nitric acid and carbolic acid, and you also have fluoric acid. Fluoric acid mainly for venous ulcers. Fluoric acid, burning pains better by cold application. Why? Because fluoric acid is a hot patient. Very good. So ulcers is very, very important. Especially nitric acid. You know, bleeding ulcers. Bleeding ulcers, nitric acid. Okay. So another very important physical general of acids is the discharges. From the general properties of acid, your student should be already thinking what the discharges will be like. Very good. Acrid discharges. Discharges which are acrid. Will they be only acrid? Excoriating. Discharges which are acrid and discharges which are excoriating. What do you understand by excoriating? It corrodes, it eats up, it causes destruction. Okay. Any other acrid excoriating discharges? Any other remedy you can think of? Very good. Alemsippa. Simple remedy. What is special in Alemsippa? What is acrid in Alemsippa? Nasal discharge. How acrid is the nasal discharge in Alemsippa? Very good. Good. Keep it up. It eats off the mustache. Okay. You know, when you have discharge and in Alemsippa, which side you have discharge? Mainly. This is a left-sided remedy. We forgot to mention. Under left-sided remedy. So left nostril, you have discharge coming. And this discharge is so accurate that it can eat up hair. Good, antiseptic. Any other remedies which have excoriating discharges? Euphrasia, which might have acrid lacrimation. Good, agreed. Any other remedies? You have many secondary remedies. Arsenicum iodatum. Many, creosol. Okay. Nitric acid. Yeah, anyway, acids, we'll talk about acids. So acrid excoriative discharges. And from the source books, nitric acid, muriatic acid, fluoric acid. Okay. These are the acids which are excoriating discharges. And the discharges can also be very offensive. Carbolic acid, nitric acid, phosphoric acid, fluoric acid. Offensive discharges. So discharges in acids will be thin, acrid, excoriating and offensive. Any discharge, for example from nose, from ears, lochoria, or discharge from the ulcers, discharge from the wounds, they can have this character. Clear? Okay. So moving ahead, what we also have is the character of pain. The character of pain. Burning, pricking, stitching, sharp, lancinating. So what do you understand by lancinating? As it pierces with a knife. Lancinating pains. And I have used another very important pain. And this pain is pain in spots. What is it? Pain in spots. Pain in spots we are talking for the first time. So you need to have some clarity how exactly a patient with pain in spots present to you. How do you think they will be presenting it to you? Pain in spots? Yeah. Your friend is telling, she's pointing out at something. See, like, for example, when they have pain, for example, back pain, headache. So when you ask for location, where is the pain? So the patient will be pointing here. Where? Here. Only here is doctor, only here. Not the entire head, only this part. I have pain in abdomen. When you ask him, where is the pain? Doctor, here. Here means here, only this part. Nowhere else. Pain in back, only that spot. So pain in spots becomes very, very important. And one acid which has pain in spots is talking of acid. Calipic is not an acid. Very good. I appreciate calipic. Good. Before we take up acids, I am very happy you thought of calipic. Good, keep it up. Calipic is the top remedy for pain in spots. You can make a note. Pain in spots, calipic. They come to your clinic with the same presentation. Only this much, doctor. My ungli mein dikha raha hu na, sirf itna. Sirf itna. So that is pain in spots. Likewise, you have pain in alemsippa. How are the pains in alemsippa? What is the word we use in alemsippa? Thread-like pains. Very good. Neuralgic pains. Pain running along the nerve. Pain running along the nerve is neuralgic pains. Alemsippa. Or many other remedies. Okay. So here, pain in spots is what you find very peculiar in oxalic acid. In oxalic acid. So oxalic acid has pain in spots. So two things you need to understand. How do you identify pain in spots in your clinic? First point. And which is the acid which has pain in spots? Hope both the things are clear. Clear? Okay. So burning pains. Majority of the acids. Nitric acid, fluoric acid, sulfuric acid, they all have burning pains, pricking, sharp pains, lancinating pains. Again, very prominent in nitric acid. Splinter-like pains in the ulcer, sharp, lancinating pains in a very long area, in the rectum, in the anus. They feel as if knife is being pierced. Nitric acid. Okay? So pains and after pains, many source books say, what do you realize from the image that I have shown you here? Very good. Pseudomembrane. Pseudomembranes. Like for example, diphtheria and other things. Pseudomembrane, which you would have studied in your second year microbiology, pathology. Okay. So many acids are capable of producing pseudomembranes. So when I say they are capable of producing pseudomembrane, what do you understand? What do you understand? They are also capable of curing pseudomembranes. So in proving, they have seen that acids produce pseudomembrane. So in clinics, what do you see? When you prescribe the acid, that acid has a capacity to dissolve pseudomembranes. Okay. So acids, especially in throat, we have acetic acid, carbolic acid, muriatic acid, nitric acid, oxalic acid, and sulfuric acid, which are capable of producing pseudomembranes. Okay? Pseudomembranes. Okay. Now, hemorrhage. We saw this image in the previous class, and this image was explained to you keeping the diathesis in mind. So what are all the types of diathesis? Hemorrhagic, scrofulous, rheumatic, tubercular, Goti and rheumatic can be combined. Okay. So one doctor, who was the person who introduced diathesis? Who introduced diathesis? Don't tell my name. Who introduced? I mean, it was a concept introduced by one person, no? Clark. No, it's not Clark. With due respect, Dr. Clark has got done immense contribution to homeopathy. Yeah, check and let me know. I mean, as a third year student, you should have it. A good I didn't ask this question in your Viva. And thank you for making me realize you are not aware. Otherwise, you would have lost marks. I'll ask you in your Viva, so please prepare and keep it ready. So, hemorrhagic diathesis. Okay. We discussed the acids. What were the types of acids? Organic and inorganic. Weak, strong. Okay. So, acids have a capacity to act on the blood. Now, why hemorrhage? Go back to the sphere of action. It acts on the blood vessels, it causes destruction of the RBCs and it causes hemorrhage. Anemia, hemorrhage. Okay. Hemorrhages are mainly seen in sulfuric acid. Hemorrhages are mainly seen in nitric acid. Hemorrhages are mainly seen in acetic acid. The acid that tops hemorrhages will be sulfuric acid, nitric acid, and a little amount is also seen in acetic acid and muriatic acid. But two acids which tops the list will be sulfuric and nitric acid. Sulfuric acid will have black hemorrhages. Sulfuric acid will have black hemorrhages. Okay. Nitric acid can have brighted hemorrhages. Black hemorrhage, any other remedy? Very good, porphyrias. Mainly crotalus. And if you want one more specific remedy, and that remedy is elapse. Elapse. Don't forget elapse. Elapse. It is also a snake. It is also a remedy prepared from snake venom. Okay. So hemorrhages, and then we also have something very important. Now what is this? Boys were shouting when we were asking them the mind symptoms. Acids are generally prostrated. Acids are generally weak. Acids are generally debilitated. And the only exception I told you is fluoric acid. And fluoric acid, in many of the other classes I have told you, fluoric acid is compared to horse, untiring horse. Right? Horsepower, and horse generally they don't get tired easily. So the only acid who will not get tired is fluoric acid. A beautiful remedy must be when time permits. If at all it comes in my portion, the only acid who will not go into weakness. They will have all characters of an acid, but he can work 3 shifts a day. 2 घंटा सोया ना बस. He's back with energy. Fluoric acid. Okay. So we come back. Picric acid, phosphoric acid, muriatic acid, sulfuric acid are few acids you have to remember when we talk of weakness. Phosphoric acid, a beautiful remedy I use often in clinic, and we have one of our friends, we had a case, one of our PG scholar, he had admitted a case in our IPD. It was a case of diabetic ketoacidosis. Blood sugars were more than 500. And he was in a very bad state. Then again, we have the video. I can't show you on the social media, but then anyway, after class I will be showing you the video for your understanding. So how acids will look? They look very lean, they look very thin, debilitated. So this gentleman, he had diabetic ketoacidosis, bad weakness, bad muscle wasting, in a very weak state. I had prescribed him Terentula, and we had also prescribed him one more remedy. Unfortunately, it did not help. Then again, my PG friends and we sat together and we tried to understand what is it that we are missing. We reworked the case and we prescribed him acid phos. Beautiful remedy. And one of our PG friends, he has the follow after acid phos. A man was lying on bed, starts walking, starts going around, speed improves, energy improves. Unfortunately, for some reason, they got themselves discharged from our hospital. I don't know what the reason was. But what 2-3 videos we have followed videos, the gentleman improved beautifully. Okay, acid phos. Very important remedy. Right? Weakness which mainly comes in diabetes, or weakness which mainly comes in acute conditions. See, I have used acid phos in many acute cases. Fevers. Okay. Fine. When they are very dull, okay, they are very weak, and in acid phos, ailments will be from homesickness. Acid phos, ailments will be from homesick. For example, my teacher Vijaykrishna would tell, father travels, daughter is very close to father. Father is very close to, daughter is very close to father. Father goes out for a trip, daughter falls sick. Remedy is acid phos. Done? So when somebody whom you are very closely attached, you get detached from them. Not detached, it's a very short period. Dad may be back within 2 hours, 2 days. Intelligent mother would have observed, every time her father travels, my daughter feels sick. Okay. And then you see, she will have a picture of acid phos. Only if she has a picture of acid phos, you have to prescribe acid phos. But remember, this is a beautiful ailment in acid phos. When somebody whom they are very close, they get separated. Okay, they miss them for some time, they fall sick. Acute, acid phos. And they are so drained, they feel so weak in acid phos, they are always lying. Okay, then absolutely no energy. And one important desire, which I will be talking to you a little later, in acid phos especially will be for juices. Their ATP will be diminished very fast. Right? The energy levels will come down very fast. So they want refreshing things. Juice mainly. Juice which will refresh them. Acid phos. So weakness in acid phos. And we also spoke of picric acid for weakness. And what was the cause in picric acid? We discussed this in the last class. Picric acid, why do they, don't turn your pages. Don't turn, don't look back. It should be here. And you should use it when it is required. कल क्लिनिक में बैठ के आप अपना नोट्स नहीं घुमा सकते ना mental exhaustion. They have exams. Okay. They study whole night and morning they are drained. They are not like Gelsemium. They have studied. Gelsemium will have more of fear. Picric acid, they have studied whole night, last 3 days non-stop, they study and they burn their calories and then they are tired. Nervous exhaustion. Picric acid. Okay. Lactic acid also has weakness. The weakness in lactic acid is mainly in diabetics. Debility, unexplained debility in diabetics, lactic acid. Lactic acid. Okay. So picric acid, phosphoric acid, sulfuric acid, muriatic acid. When you study the drug picture of muriatic acid, you realize there is so much of physical weakness. And they just slide into the chair. They will not sit, they slide into the chair. That is the amount of weakness. The muscles are in a state of weakness. And muriatic acid, sliding into the chair. You also have sternum. Sternum has more of nervous weakness. They just they go sit on the chair. Right? And muriatic acid will slide into the chair. So acids which have the ability, phosphoric, sulfuric, muriatic, picric, lactic acid. Okay? Odor of coffee causes weakness. I'm sorry for the color. It's not, here in my laptop it's very neat, clean, but must be some issues with the projector. No issues. I'll just read it for you. Odor of coffee, bringing on weakness. Single remedy is sulfuric acid. There are many coffee lovers. Right? There are many tea lovers. Yeah. Okay. There are many other lovers. So we'll not explore that area. But my area here is like the coffee aroma can bring in life in many. Coffee aroma. For example, you're passing and you just smell coffee and you feel you're back to life. Right? But unfortunately in sulfuric acid, they're fine. They smell coffee, but that coffee will make them low. Okay. If you are lucky to get a friend like this, you can think of sulfuric acid. Only remedy mentioned in our literature, sulfuric acid. Okay. Weakness which arises from defective nutrition, mainly from blood disease. You understand? Yesterday's patient, though he was lean thin, I did not prescribe acid. If you listen, after 11:30 when I went back home, I showed this case to my wife, the video, because it was a very important case. I was discussing with her. His energy levels are very high. He is very loud. He is very sharp. Acids in that state will be very weak, will be very prostrated. So I did not think of acid. And acid did not match his pathology. So acids were ruled out. Okay. So we'll go ahead. Hemorrhages, sulfuric acid, nitric acid, phosphoric acid. Okay. Now many of you are keen to know the desires and aversions of acids. Acids, any wild guess what the desires are? One I have already given. Refreshing things. Sour things. What is it? Sorry, I've prepped my ears so difficult to catch the bird. And sometimes, you tell something, the moment I look, you are saying, no sir, it's not me. Okay. What was the answer given? Juice. Okay, good, very good. I appreciate juice. Refreshing things. I told you especially acid force. I'll come to it a little later. Acid force has desire for refreshing things. Okay. Spices. They want the food to be spicy. We go to the hotel, the waiter comes and asks, sir, आपको spicy चाहिए, medium spicy? Yeah, no spicy. If you have a friend who is acid, he says, maximum spicy. And few of us, we are, it's fine. And few of us, generally we go to certain restaurants spicy food. Andhra style. Okay. Not that everybody who goes to Andhra style don't keep box of acids outside and people going to a restaurant, they can have their own ideas, but generally liking more of spicy things can be acids. So spicy and they love stimulants. Debauchery is what we saw as the element in acids. Loving stimulants, loving alcohol, okay? Sour things, kattachis, indigestible things. You have patients coming to us telling, I can eat chalk, I can eat eraser, I can eat pencil. My house wall is all having a lot of tips. There are a lot of holes they would have scraped and eaten. Okay? So desires, undigestible things. Okay? One acid I want you to remember here is nitric acid. Nitric acid. And when somebody is having desires for undigestible things, one thing I want you to rule out is anemia. Please rule out anemia. When you read anemia in medicine, there is something called as desires for pica. P-I-C-C-A. Right? So, desires for all of these things. You have people eating mud. You have people eating papers. You have people eating pencil erasers. I don't know what else. Something that is not digested, you see people eating. If they are not anemic, then it will become important. If they are anemic, it can be common. Not every anemic person will eat, but then you correct the anemia, this automatically goes. Okay, in spite of your HP being 12, you feel like eating all these undigestible things, it will become characteristic. Okay, so desires, I have just given you the remedies, fluoric acid, nitric acid. Having desires for spicy, fluoric acid, phosphoric acid, sulfuric acid, having desires for sour things, and desires alcohol, sulfuric acid, uric acid, fluoric acid should come on top. Fluoric acid, beautiful remedy, carbolic acid. These are the remedies from the acid group which have desires for alcohol. Okay. What are all the aversions? The acid group, generally they don't like in eating. One very important thing is meat. And the acid which has aversion to meat is muriatic acid. Strong aversion to meat, muriatic acid. Okay. Bread, meat, okay, few acids, especially fluoric acid, it is given in both desires and aversions for refreshing things. You can ignore this, at least remember bread and meat. And fluoric acid has both aversion and desires for refreshing things. Okay. One of your friends, when we spoke of generals, she was talking of thirst. Majority of the acids are thirsty. There are a few acids which are thirstless. I will discuss. Majority of the acids are thirsty. Like you have a list. Acetic acid, but in fewer. Acetic acid is thirstless. Remember. Carbolic acid, sulfuric acid, benzoic acid, oxalic acid. And they hardly drink water. Thirstless. Which are all the acids which are thirstless? One acid you need to remember is phosphoric acid. They might drink juice, they might drink refreshing things, but they will not like water. Or they will not be thirsty for water. Phosphoric acid, hydrocyanuric acid, and nitric acid. These are the thirstless acids. Okay. So moving ahead, the last thing, or last few slides, majority of the acids are indicated for cancer. Okay. Majority of the acids are indicated for cancer. Like for example, you have acetic acid. Is acetic acid done? Yes. So So, in which cancer you can think of acetic acid? Acetic acid mainly for stomach. J. CS stomach. When you have all that coffee ground vomiting, okay, acetic acid. Carbolic acid, mainly in sarcomas. Mainly sarcomas. Okay. Muriatic acid, mainly in ceaton. Muriatic acid, mainly in ceaton. Picric acid. Any wild guess? So much was spoken about picric acid. Any wild guess? Picric acid? Mainly in debility. See, there is something called as cachexia. Huh? You know, where they feel very lean, thin, emaciated, weak. In advanced cases of cancer, you see this state. When the cancer has spread metastasis to different organs, and in last stages, they are lean, thin, weak, emaciated. Why? Picric acid. Picric acid. And you also have nitric acid when you have bleeding, when you have cancer in the ulcerative stage. Burning, severe bleeding. In the ulcerative stage of cancer, you can think of nitric acid. Okay? And you also have sulfuric acid. Weakness, tiredness and other things coming up in sulfuric acid. So these are the acids which are indicated in cancer. Okay? Now the last part of today's presentation will be the general modalities of acids. General modalities of acids. So lot of things. Night exertion, cold food, drinks, loss of vital fluids, loss of sleep, mental tension, mainly seen in picric acid, nitric acid, anxiety, worries, again seen in nitric acid, grief and death. What ameliorates? Rest, heat, eating, discharges like profuse urination. You have one symptom in a remedy which is done for you. Headache better by profuse urination? Huh? Yeah, louder, good. Headache better by profuse urination. Gelsemium, good. An acid in which you have a headache better by profuse urination is fluoric acid. Fluoric acid. Short sleeps, rest, they feel better. They feel better. Okay. You want the previous slide? Okay. See, if you are lucky, it can be a 10-mark question. But we always see beyond the picture, and the classes that are done for you, they are for your life and they are for your practice. I know your immediate goal will be exams, but always have long-term goals. Okay, so the class should have an impact on your practice. That is very, very important. That is important. Okay. So this is all about the generalities of acids, and one heading, orphalate I have started including in group study is clinical indication. Very important. That's what I was trying to focus. Whatever theory we are doing, without a clinical importance, the class will go west. So the main idea is, where are the acids used, or in which condition one can think of acids in future becomes very important. Okay. So any quick inputs from your end, having heard for almost 2 classes, 45 minutes each, where do you feel acids can be indicated? It is an activity, it is open for you, and you can answer. Huh? What is it? Apthe, very good. Okay. So you want to go with alphabetical order. Good. Beautiful. I appreciate it. Very good. I am happy you started with A. We can talk till Z. The only thing is we should know the sequence ABCD. It's been so many years we would have forgotten. Okay, good. Anemia, arthrosalsus, good. Anything else? You need to have little love. I have told you my problem. I have in this, so I can't hear. Cancer, very good. So after A, C, very good. Nothing to do with B. Bleeding, very good. Bleeding, memorize this. Bleeding. Burning pains in cancer or burning pains in ulcers are a very good remedy for cancer. Bad effects of anesthesia, very good. Yeah, creative. B. It also includes A. Anesthesia, very good. Bad effects of anesthesia, good. Keep it up. Then I thought this will. See, don't be very specific about ABC. That's why I told you. You'll be thinking after A what. So don't waste time there. You are not very. I mean, if you talk from alphabetical order, it will be systematic. You will not forget. But don't strain yourself much with the alphabetics. After A, then क्या B, उसके बाद C, D तक तो चले जाएगा. D के बाद क्या वो थोड़ा मुश्किल हो जाएगा. चलो. Good. Hernia. Very good. See, mainly hernia, sulfuric acid. Okay. One important remedy for hernia could be sulfuric acid. Good. Nitric acid. Okay. Induration of the connective tissue. C. Connective tissue affections. ABC. Connective tissue affections. Good. Then abscess A. B. Boils. C. Cancer. C. Cachexia. Okay, yeah, fissures, good. Fissures, hemorrhoids, constipation. Okay, then eruptions. Okay, good. What else? See, paralysis. I was trying to tell you. Ascending type of paralysis. Which was the remedy we discussed? Oxalic acid, very good. Oxalic acid, ascending type of paralysis. Bedwetting. Okay. Urinary affections. I am sorry, I am jumping to you, but urinary affections. Strong smelling urine. And urine smells like that of phosphorus urine. Benzoic acid, nitric acid. Strong smelling urine. Urinary complaints, calculate. Renal calculate. Okay? Then anything else? Skin affections, ulcers, abscess. What is this? Something keloid. Okay. Then typhoid. Different types of fevers. Viral fever, typhoid fever, prostration, muscle weakness. Good. Anything else you can think of? Bleeding disorders. Gout. Good. Is there? Gout. Joint affections. Rheumatism. Gout. Vision problems. Okay. We have a lot of bleeding. Okay, a lot of those conditions. What is it? Leukorrhea, infertility, male issues, female issues. You can talk organ based, muscle weakness. Okay. Diabetes. Then leukorrhea, abortions, DUBs, cancer of uterus. I mean, male, female, eyes, nose. You can talk of rhinorrhea, you can talk of otorrhea, offense otorrhea, aphthous ulcers, CS stomach, gastritis, going down, liver. Fine. Sulfuric acid is a beautiful remedy acting on liver. Cirrhosis of liver. Alcoholism. And in sulfuric acid, there is something very peculiar in sulfuric acid. Even water, they cannot drink without mixing alcohol. I hope you are clear. Even water, plain water they cannot drink. Few drops of tirtha, few drops of alcohol they should add. Only then they can drink sulfuric acid. Okay. Sleeplessness. What is it? Muscle exhaustion, prostration, examination funk. You name it, you have it. Caries of bones is a very deep-acting remedy. Osteomyelitis, tumors of the bones. Okay, hair fall, alopecia areata, phosphoric acid, fluoric acid, beautiful remedies acting on hair. Anything from head to toe. You can think of nasal bones going into caries. Fine, tumors. You can think of acids. Okay. So before we close, any questions related to acid groups? And this is the first group I have taken for you students. So the objective was how to study a group acids as an example. Hope you are successful in trying to convey the message. We have recalled the common acids we use in homeopathy. We enumerated the spiral action, ailments, physical appearance, diathesis, etc., thermals under introduction, and we focus on the mental generals. And in this class, this was done in the previous class, the first three objectives. Fourth objective, the physical generals was told to you in this class, and we also tried to list the clinical utility of acids. One acid you should remember having a beautiful action on bones is fluoric acid. Beautiful remedy. See the depth, and when we do fluoric acid, you will also realize the kind of problems fluoric acid can cure. Okay, varicose veins, varicose ulcers, you have got plenty of things an acid can take care. Okay, so if you have no questions, we will go to the next part of the class. If at all you have any questions, anything you would like to add, compare, you are free. Anything you would like to add? Guys, all clear? Okay. So if you are lucky, 10 mark question or a 5 mark question on acid group. Okay, so thank you. Thanks.